Good day, afternoon, and good evening, everyone. Lesbian, gay, bisexual, and transgender, intersex, and queer people's experiences in humanitarian emergencies have been overlooked, leading to invisibility in many emergencies and very few specialized services to meet their needs. In many countries in the world, people of sexual and gender minorities face extraordinarily high levels of sexual and gender-based violence, yet remain unseen in many GBV programs. Today, on the International Day Against Homophobia, Transphobia, and Biphobia, we're pleased to conduct this webinar on gender-based violence and sexual and gender minorities in humanitarian emergencies. The GBV Area of Responsibility Community of Practice, in collaboration with the Interagency Working Group on Reproductive Health in Crisis, the sub-working groups on GBV and LGBTIQ, are very excited to welcome you to this important conversation. My name is Maria Holtzberg, and I am Gender and Inclusion Advisor at International Planned Parenthood Federation. I will shortly hand over to Sarah Martin, GBV expert and the facilitator of the GBV AOR Community of Practice, among many other things. Before we start, we kindly ask that you mute yourself. There will be opportunities to ask questions on the chat box, and we will be maybe open for dialogue. I am now seeing that there are some persons who are not hearing audio. Can you confirm, can someone confirm that they are hearing this?
I hear you fine, Maria.
Excellent. I will then hand over to the lovely Sarah to take this webinar forward. Over.
Thanks so much, Maria. My name is Sarah Martin, and along with Beth Van, I'm one of the co-facilitators of the GBV Area of Responsibilities Community of Practice. Can you go to the next slide, Maria? We're really excited today to be able to bring together three people who've been doing some really fascinating work on this topic to start a conversation on the issue of gender-based violence and the LGBTQ population that we are serving in humanitarian emergencies. Next slide, please. You're going to hear today from Claire Wilson, who is a coordinator, a researcher and a consultant on, next slide, please. Claire Wilson, who's a researcher and a consultant. She's normally based in Lebanon, but she's calling in today from London, and she's going to lead us through some basic information and some of the interesting stuff she's doing. Then Emily Dwyer as well, the managing director of the Edge Effect and the level 42 degrees, calling in late at night from Australia. So let's be nice and patient to her since she's staying up super late to be able to talk to us. And then Dr. Sarah Chenoweth, who is with the Women's Refugee Commission. So Claire is a practitioner and a researcher whose work focuses on matters of gender justice, sexual rights, and humanitarian response, particularly in the Middle East, North Africa region. She's currently a field coordinator in the Humanitarian Resilience Program for UN Women and a research associate with the Women and Gender Studies Initiative at the American University in Beirut, where she studies feminist research methods. Emily, again, is the co-founder and managing director of Edge Effect and its not-for-profit subsidiary, 42 Degrees. So the Edge Effect strives for rights, needs, and strengths of people of diverse sexual orientation and or gender expression and sex characteristics, urging that these be addressed in humanitarian development aid contexts. Sarah is the founder and director of the Sexual Violence Project at the Women's Refugee Commission. She's been working in humanitarian emergencies for 16 years, primarily focused on sexual and reproductive health. So thanks so much, you guys, for taking the time to be with us today. And I'm now going to welcome you all on the International Day Against Homophobia, Transphobia, and Biphobia, and turn it over to Claire. Next slide, please.
Great. Can everyone hear me okay?
Loud and clear.
Okay, excellent, great. Hi, everyone. So Sarah asked me to start off with some brief definitions. I know we're all approaching this topic with different backgrounds and relationships with LGBTIQ issues. And I think with people who are less familiar, there's often a lot of confusion and fear of using wrong words or offending people. So I think while it's important to have some basics, particularly as it relates to our work on GBV, it's also important to recognize that there is a lot of variation in terms of what words we should use or people want to be referred by when we talk about LGBTIQ issues generally. So one of the most common frames in the international community thus far in the humanitarian sector is LGBTIQ+. This usually refers to lesbian, gay, bisexual, transgender, intersex, and queer people. And often the critique is that it's very Western-centric and doesn't include other sexual and gender minorities, meaning people whose gender or sexual practices don't conform to norms or mainstream standards in different societies. So another umbrella term that people are using are also people of diverse SOGI-esque. This is often considered to be a more inclusive term, but far less used, and it's an umbrella term that doesn't talk about individuals based on identity, but in terms of sexual orientation, gender identity, gender expression, and sexual characteristics. So it's a much a broader and more inclusive term, and particularly when we talk about global humanitarian settings, allows us to incorporate other groups like the Aravani or the warrior or Hijra population, which are third gender groups in South Asia and are not included in the more Western-centric LGBTI term. So next slide. So happy to speak more about definitions or talk about more about that in the Q&A, but as we have limited time, I just want to give a very brief overview on that. The first point and main takeaway that I'd like to make in my short remarks is that there is a global humanitarian protection gap when it comes to the protection of LGBTIQ persons in humanitarian emergencies. And what we see from very nascent research on this topic is that although LGBTIQ plus persons are some of the most at risk to violence in many different ways from many different actors, there are extremely few resources to support them in terms of service provision, allocated funds, staff with expertise, or even really basic knowledge and research about what's happening to these groups. Fortunately, that is changing. And we have some really incredible thought leaders that will be sharing in more detail today what some of that research is saying. But I'd also like to talk about, why are these groups so structurally vulnerable? So just to highlight a few points from what the research shows is that first, peacetime can be a humanitarian crisis for these groups. So I think this is a really important framing when we think about just where LGBTIQ persons are at in terms of their risks in some societies and states without the effect of war or natural disaster or a refugee crisis. And then, of course, emergencies make it worse. You have a loss of social networks, loss of normality, and this exacerbates the situation. You also have violence from multiple actors, and this can be from governments, real state oppression in manifold ways, armed groups, communities, even families, and sometimes discrimination and violence from aid workers themselves. And then despite all of this, there is often less access to services for these groups. Next slide. Slide, please. Another important point within this global protection gap that I'm arguing to show is that the majority of global humanitarian emergencies actually take place in very homophobic and transphobic states. So if we look at, in 2018, some of the largest refugee host countries, Jordan, Pakistan, Iran, Chad, Turkey, Ethiopia, Uganda, and Lebanon, all of these states criminalize homosexuality and non-binary gender identities. And similarly, if we look at states with active armed conflict, Iraq, Yemen, South Sudan, Libya, DRC, and others in Syria, these states are also rife with homophobia and transphobia. So while this creates a very tricky environment for humanitarian agencies to collect data, provide services, and advocate with governments, it also makes it all the more necessary to really take this issue up. Next slide. Yeah, great. So, and the last area that I'd like to talk about is just how this links with GBV. So what I wanted to highlight as well is that there are specific types of GBV that are being neglected in humanitarian response, and we don't have good information or knowledge about them or great tools to respond. And I think that as GBV practitioners and for those in this webinar today, it's important to recognize that there are types of GBV affecting these groups that need to be on our radar and that we need to start mobilizing to address. So a couple of those types of GBV, I'll just go through briefly, include anal exams. This is a type of violence caused by a perpetrator inserting a finger or an object into the anus, usually in order to determine someone's sexual orientation or provide evidence for homosexuality. And anal exams have no medical justification at all and are actually classified as a form of torture. And they typically target gay men or men who have sex with men. And there's lots of evidence of this taking place by states in particularly. Secondly, corrective rape. It's a type of rape, a sexual assault, where a person is attacked because of their perceived sexual orientation or gender identity, usually with the intention to change the person to become heterosexual or gender conforming. And we've seen most evidence of this happening in South Africa against Black lesbian women. But surely it's happening in other places. There's a little bit of evidence of it happening against Syrian refugees in Lebanon, but not also LGBT-related honor killings. You know, in the MENA region, we have a lot of conversation about honor killings happening to girls, but also not always inclusive of LGBTIQ persons. And lastly, I also wanted to highlight sexual blackmail against aid workers. There was a great report that came out from Feinstein called Stop the Abuse about sexual harassment against aid workers. And one of the things that they documented in the research was sexual blackmail of LGBTIQ aid workers. And it's basically a form of sexual exploitation where a survivor or victim is coerced into performing a sexual act in order to keep their sexual or gender identity confidential. And so this is also happening in humanitarian emergencies. And I should say not just to aid workers, but this idea of sexually assaulting someone in order to, and then threatening to out them if they report it. And then lastly, also to highlight just the rate of sex work by trans people globally, which is often survival sex, not always. And there are some stats there just from Transgender Europe, just to highlight, we should also be looking at survival sex of trans persons in humanitarian emergencies, which is often cut out of the conversation and not on our radar. So those are just a few kind of broader overreaching remarks to kick us off from my side, but I will chime in a bit later. Thanks.
Thanks so much, Claire. And now I'm going to turn it over to Emily with the EDGE effect.
Thank you very much, Sarah and Claire, and thank you to everyone who's taking time out of your day today on Ida Hobbit Day to join this webinar. The I'd just like to start off here just with some framing remarks as well before we get in, I guess, some of the details of the kind of violence that the people do experience a little bit later during the webinar. I mean, Claire's done a great job there of talking about some of the different language and acronyms and terms that are often used in regards to these communities and these issues. I guess I'd just like to sort of problematize that or raise some issues about an identity-based approach to working with people of diverse SOGIESC, to use that language, or talking about LGBTIQ people, or talking about sexual and gender minorities. And I mean, aside from a whole range of issues around neocolonialism, about putting people in boxes, about terms that are maybe more familiar for people in the global north, terms that are very difficult to translate into other languages, I think putting all of that aside, all of these ways of framing this group of people involve various degrees of othering. Various degrees of pointing out, well, what is it? How are these people different from everyone else? And I think there are a few risks that we need to think about in working in that way. One is, I think there is a bit of a risk of tokenism in the way that we address gender-based violence and other issues in humanitarian and development contexts. Now, there is a bit of a risk of what I sort of call the word processor approach to inclusion, sort of going into our documents and finding the long lists of marginalised groups and just adding LGBTIQ. There is also a history of extractive approaches to marginalised groups within the humanitarian and development world. We've seen that with people with disabilities and other groups. And then marking out what's different about LGBTIQ people also potentially opens up that. In many ways, it's not protection-based because, the way that we work, all people should ideally be able to access services that they need to access when they need to access them without having to identify themselves. And so I think focusing on what makes people different also raises some potential protection issues. But I think along with all of those, there's a real risk that we don't get to the heart of the issues. And by that I mean that the violence, gender-based sexual violence experienced by lesbians doesn't happen because of something about lesbians. Violence that gay men and boys or trans women experience isn't because people are gay or because of something about being a transgendered woman. And this reminds me of a legal defence that thankfully is now no longer exists in Australia. I'm not sure about all other jurisdictions. It's sometimes called the gay panic or the trans panic defence. And this is a legal defence, if you're not familiar with it, where people who had murdered or enacted other violence on say someone who was gay or someone who was trans or a lesbian would say, well, it's not my fault. I got freaked out because they're different, and I was surprised or something like that. And it's a way of victim blaming in a sense. So one of the first things I'd just like to suggest is that we consider taking a norms-based approach. So that rather than talking necessarily about how to include LGBTIQ people, we could instead talk about, well, what are the reasons why those people are excluded in the first place? And that takes us to the first slide and a couple of norms which are there. One, heteronormativity, and another, cisnormativity. Hopefully you've had a chance to quickly read those. And I don't want to get too bogged down in big words, but essentially heteronormativity is just the idea that everyone is or should be heterosexual, and that we make laws. We design programs, we have social institutions, we design programs, we collect data around the idea that people are in heterosexual relationships. But of course, not everyone is. And so then you can ask questions about, is a lesbian couple a family or a household for the purposes of humanitarian assistance? Cisnormativity, which is maybe less familiar as a term, the belief or assumption that your gender is aligned with what is known as sex assigned at birth. So to use myself as an example here, when I was born, the doctors looked at me, they looked at my genitalia and said, "It's a boy." Well, actually, it's not a boy. I'm a girl. They got it wrong, and so in a cisnormative world, my identity is essentially doesn't exist. So in our world, we in the way we do programs, the way the world is structured, we often assume that the transgendered people don't exist. Next slide, please, Maria. And two more norms here. One, gender binarism, so the assumption that everyone fits into one of two boxes, like everyone is either identifies as a woman or identifies as a man. And there are many people, our Avani community, others who've already been mentioned who don't, who are third gender groups. And finally, dyadism or endosexism. So this is, again, another sense of binarism in a way. But it's the assumption that, sort of physiologically speaking, that all people fit into boxes that the medical profession has defined as male or female. And here, this is the I in LGBTIQ, if you like, that for a lot of people that's not the, or actually, yes, for quite a lot of people that's not the case. So we can think about the idea that the violence that we're talking about here is violence that happens because people are breaking those norms in one way or another. That lesbians are not holding up, they're not being heterosexual. That gay men and boys are not being heterosexual. That transgendered men or women are not fitting into a cisnormative world. And I think in terms of the humanitarian context, this helps us to sort of think about the kinds of social conditions in societies before emergencies and how a lot of that those experiences and those norms that exist impact people's experiences during and after emergencies. I think it also focuses our attention, or should focus our attention, on our organisations and the work that we need to do. What are the assumptions that we're making? What are the assumptions that are embedded in our tools, in the way that we deliver aid, the way that we collect data, make assessments and design programs? I think if we look hard at a lot of our tools and frameworks and designs, some of those norms that we've talked about, some of those assumptions certainly do exist. I think it also helps because there are lots of other norms in society, and people, someone's sexual orientation or gender identity is one aspect of their identity, but there are lots of other norms and lots of other intersecting forms of marginalisation and discrimination that we need to take into account as well. Slide, please, Maria. So that's sort of one overall framing issue I just wanted to set up, just so that idea that maybe we could talk about what are the norms that are effectively excluding people. If we can go to the next slide, and I'll sort of move through this much more quickly. Let's see the next slide come up yet, but sort of looking at, hopefully the slide will come up, is a slide about some work that we did in Fiji, a project called Down by the River, which is looking at people's experiences. So yep, that's the one. Before, during and after Tropical Cyclone Winston in 2016. And so this drew on, we use storytelling as a form of community research. But one of the things I just wanted to highlight here was the significance of informal networks. One of the things that we found was that obviously informal networks are really important for people of diverse SOGIESC all the time, but especially so in emergencies. It's the way that people can survive when the system is not providing support that they need. And I think it's really important for us, especially in a context where there might be restrictions or limitations on the way that our organisations can act, for us to take note of existing community-based response, not to interfere with that, not to put that at risk, and really to respect what communities are already doing to support each other. And I'll come back to that later when we talk about some of the work in the Asia Pacific. Thank you very much.
Thanks so much, Emily. That was really great. Next up, we're going to hear from Sarah Chenoweth a bit more about your work with the Women's Refugee Commission. Over to you, Sarah.
Thank you, Sarah Martin, and hi, everybody. So over the past year, the Women's Refugee Commission has undertaken a qualitative exploratory study. We're primarily focused on male survivors of sexual violence, including those with diverse SOGI. And today I'll just highlight the findings related to refugees to LGBTI refugees. So we looked at this issue in 3 different humanitarian contexts, both conflict-affected settings as well as corresponding refugee settings. So you can see here on the slide with the Rohingya in both Myanmar and Bangladesh, refugees traveling through Libya into Italy, and then refugees from DRC, Somalia, and South Sudan living in Nairobi and Mombasa, so in urban areas, not in the camps. I don't have time to go through the full research design. We had a number of limitations, but all of that is available in our reports. But I would like to emphasize that this is very much exploratory research. We need to do much more in-depth research on this issue to really understand what's happening. Next slide, please. I'll just dive right in. Yep, okay. So I'll talk a little bit about the findings from the conflict-affected settings, starting with Libya. Very interesting. We found that gay male refugees who passed as straight appeared to be subjected to more or less the same abuse as other men, which I should emphasize is high. But for gay men whose sexual orientation is revealed, so for example, if a guard or militia takes their phone, they immediately look at the photos, and which may indicate that they're gay. In these cases, they appear to be subjected to intensified sexual violence. So we heard accounts of gay men being sexually enslaved, trafficked for sexual exploitation purposes, which we didn't hear about straight adult men or gay men who passed as straight. And for lesbians, on the other hand, which we unfortunately don't focus very much in our research, but we did collect some data, which I'll share here. For lesbians, they appear to be subjected to significant sexual violence and exploitation, but the research participants we spoke with said this was not because that they were lesbian, it's because all women are at such high risk of sexual violence in Libya. It has more to do, in this case, with their gender rather than their sexual orientation. At least that's the initial impression. Then in Myanmar, with the Hijara Rohingya, these are third gender persons or trans women. Really difficult to find out what's happening to them in Myanmar. So we're still trying to figure this out, actually. So we don't know whether or not they were specifically targeted for conflict-related sexual violence in the genocide, but we know they were certainly targeted for violence and sexual violence by other members of the community. And then finally, for refugees from South Sudan, DRC, and Somalia, even those from very conflict-affected regions, the people that we met with talked almost exclusively about violence, including sexual violence, from their families and communities. That's who they were being targeted by. That's often the reason that they fled. That doesn't mean they weren't also being subjected to conflict-related sexual violence, but that's what they spoke about as their main drivers. And this is in stark contrast to adults, straight men who largely spoke of conflict-related sexual violence or sexual violence during flight. Next slide, please. Okay, so the findings from the refugee settings, Italy, Bangladesh, and Kenya, they were pretty similar, actually. Refugees with diverse SOGI face a lot of the same challenges, not just in these settings, but globally. Many of them have fled from camps where they face a lot of violence from within their own communities. They go to cities where housing and livelihoods are a big challenge and where violence from the host community is a real threat. We found in Bangladesh and Kenya, in particular, they were at particularly high risk of sexual violence and exploitation. In fact, all the refugees with diverse SOGI that we met with in Kenya had been subjected to various forms of sexual violence, often multiple times. They were subjected to corrective rape, both men and women, cisgender and trans. They generally don't have access to livelihood opportunities, which are already so diminished for refugees, as we know. They don't have much access to financial support, and some are engaged in sex work, which puts them at high risk of sexual violence. And one example in Kenya, some trans and gay refugees, they could only afford one meal a day. So some of them were engaged in sex work and then were pooling their money to provide basic support to their gay and trans friends who weren't able to work, maybe because of HIV-related illnesses or others. But it was a pretty dire situation. The last thing I would like to say is that in terms of clearly, all refugees with diverse SOGI are vulnerable to sexual violence, but trans women are particularly vulnerable, in part because of visibility issues, as are LGBTI youth, sex workers, and also trans men. Trans men are often overlooked, but they do exist. They are there. They often have very complex sexual and reproductive health needs. Many have been raped. Some of them have children or are pregnant, but they don't feel comfortable accessing care at sexual and reproductive health or GBV facilities aimed at women. And it really highlights how we can't lump all refugees with diverse SOGI together. It's ineffective, it's also disempowering, and we even have to differentiate within specific groups. So trans men and trans women have very different vulnerabilities and needs that we have to take into account. I will stop there. Over to you, Sarah.
Thanks so much, Sarah. It's always like talking to ourselves, Sarah and Sarah. But so the next question that I had, if you could advance the slide for me, Maria, is we're getting a better view of what the problems are. But now I'm a bit more curious about what are the promising practices? What are you seeing out there? And I'll ask Claire first. Claire, can you tell us a little bit more? Claire, can you unmute yourself?
Unmuted. Hi, everyone. I think a first really important answer to this is that we are all learning what the promising practices are. We're still at a phase where the humanitarian community and GBV researchers and practitioners are trying to figure out what this is. And so if you're not already working on this to some extent, I would also just make a call to action and say, you know, what is your organization doing on this? What tools do you have? What information do you have? What data are you collecting? What experts or staff do you have in your organization that could be helping us get on board and developing more tools for this? Because there really is a dearth of information, though. That isn't the only thing I will say, and I know others in the discussion today have other suggestions, and we do know some things about what works and what is working in some contexts. The first thing that I will say, actually, I'm going to draw most of my remarks from a GBV case management guidance note that was developed by the GBV task force in Lebanon. That's looking at, you know, how do you do case management really much at like a field level for LGBTIQ persons. And I think another important point within this is that often, you know, the services or the needs of LGBTI survivors are not that different from non-LGBTI survivors, though there are some specific things that we can be doing to, you know, increase our outreach to them and better our response. But in general, a lot of the practices do stay the same in terms of what we know as for best practices in GBV. And my take on how some of the services do change are first in safety planning. Oftentimes there are going to be much less options for shelter. Usually shelter options are geared towards cis women and can be very unsuitable for gay men, for transgender women, etc. And also in looking at safety planning, we have to be very cautious about involving the authorities and police, which in some contexts we hope would help in protection, but in many countries, as I mentioned, in global humanitarian emergencies, LGBTIQ survivors can be accused of a crime if reported to the authorities. Like, for example, if a male Syrian refugee is raped, he can be accused of homosexuality and therefore involving the authorities in protection cannot be a part of safety planning often. And then also access to legal justice, for these same reasons are often much less. So what are some tips? Again, brief tips given the amount of time we have, but some of the tips from the case management guidance note include using SOGI language very carefully with survivors and really letting the survivor take the lead in sharing about their sexual orientation or gender identity, and sharing what pronouns they want to be using and how much they want to share about that part of their life, and how much of their SOGI SOGI identity intersects with their GBV care. Secondly, also just being extra cautious about outing the identity of the survivor to staff or people working on the case. So if someone discloses to you not just about their assault, but their sexual orientation or gender identity, as practitioners, we should take extra sensitivity about keeping that information private, as it can impose more risks for the survivor. And then thirdly, having supportive LGBTI symbols around. I mean, this can really depend on the context, but things like the rainbow UNHCR pin or posters can, if and when true that they are being shown in a context and amongst people that are actually strong allies or supporters of LGBTI issues, can really help to build trust and make sure that the people trying to access GBV services and care know that that's the case. So yeah, those are a few comments from my side for now.
Thanks a lot, Claire. Now I'm going to ask Sarah Chenoweth to come back on, and if you could tell us a little bit more about what you found in your research.
Thanks, Sarah. I think because we have so many people on this call, which is amazing, I'm going to skip the service provision. It would be great to have time for questions at the end. So let's just skip this slide and go to the next one on promising practices in Kenya. Yes, great. So I'm going to highlight two promising practices. The first one is the Community Empowerment and Self-Support Organization, CESSO. It's an LGBTI refugee-led organization in Kenya. And here are some pictures of their safe house that they founded. They have rabbits, they have chickens, they grow vegetables. This helps with both nutrition, which is really important for people who have HIV, as well as livelihoods. They can sell these items, which minimizes their reliance on sex work. They have around 15 spaces in total. People can come in for 2 to 3 weeks for a short-term emergency. If you're in a really bad way, you can come in, you get a space. And there's also space for longer-term care, for example, for people who are on HIV treatment. They're also looking to set up a second house. And what was really neat about Kenya is that there are a lot of local refugee-led LGBTI organizations doing really amazing work. I just plucked one of them, but they are there. We should learn from them. We should document what they're doing. They don't have much funding, but they are innovative, and they're really trying to help their communities. Next slide, please. So this is a photo. I'm not sure if you can read the letter here, but the second promising practice is from Cox's Bazar in Bangladesh. It's a project being run by an organization called Legal Action Worldwide Law. The Women's Refugee Commission has a pilot project with them. We're focused largely on male Rohingya survivors, but we've also recently expanded to include a group of Hijara. And the idea is to provide ongoing training and support and mentoring to the Hijara Rohingya so they can act as survivor advocates within the community to help other Hijara survivors access services. And you can see this, I just think it's an amazing letter that they wrote together, which they submitted to UNHCR. Basically, it's a request asking UNHCR not to list them as male on their identity cards. It puts them at risk, it restricts their movements. And also access to services. And as I understand, the head of UNHCR Protection in Cox's Bazar is going to meet with them to discuss this, which is great. And just yesterday, there was the first meeting of a new interagency task force on Hijara refugees in Cox's Bazar. This includes UNFPA, UNHCR, and others. So progress is definitely being made, and it'll be interesting to see how all these efforts unfold. Okay, I'll stop there. Over to you, Sarah.
All right, thanks again. Now, lastly, I'm going to ask Emily to conclude with a bit of the information that she has, and then we'll leave about 10 minutes for questions, if you have questions. So you can ask your questions in the chat box, and I'll be moderating them. Emily?
It's so hard to to be short, because it is an exciting area, and I want to acknowledge that while we have been talking about a lot of the problems, a lot of the challenges that people face, I think this is an area of emerging practice, and there are some organisations doing some great things. I think it's also really important to recognise the strengths that exist within communities and within diverse OGS or LGBTIQ CSOs. So I just want to sort of briefly touch on an event called Pride in the Humanitarian System, which was a consultation which was held in Bangkok in June of last year, was co-organised, it was one of the partners, IPPF, UN Women, ASEAN Sochi Caucus, Asia Pacific Transgender Network, and APCOM. I think I got everyone there. And essentially it brought together civil society actors from more than 20 countries across Asia and the Pacific, to share the kinds of the stories of marginalisation that they've experienced. Often in a context in Asia and the Pacific, these are rapid onset disaster contexts, so people's experience getting whether they could or couldn't safely access shelter or a variety of other support in those contexts. So that and this was a consultation which had one day of training for those CSOs, so that they get to know the humanitarian system better, and so that they can engage with it from a position of strength and in a more equitable kind of way. The consultation provided a deeper understanding to understand, what are the drivers of the kinds of violence, discrimination that people experience in emergencies. We looked at the kinds of data that often doesn't exist, the data that's not collected, and how the lack of this data often means that program designs and funding then doesn't flow. But then also looked at the ways we might be able to improve assessment tools and other tools. I think one of the strengths and one of the things that we could look at is not allowing this just to be siloed within the protection area. I think the GBV guidelines within the global protection cluster have some of the best recommendations, or has gone further than most documents in terms of providing specific guidance, especially some of the support materials for those guidelines. But this needs to be taken up by shelter clusters, by WASH clusters, by education emergency clusters across the system. So coming out of Pride in the Humanitarian System, there was a call to action. So community groups themselves saying, well, we actually need to be at the heart of this. LGBTIQ people of diverse OGS should be the people who are being consulted, who are part of design, part of implementation, part of evaluation. Much like communities of people with disabilities, nothing about us without us. There was also a series of recommendations, and we can sort of flip through these slides really quickly, and maybe we can get these slides afterwards. Recommendations from the group as well as the CSOs, so the group of CSOs and humanitarian actors. We touched on things like the importance of funding for LGBTIQ civil society organisations, so that their engagement in the system is not merely tokenistic, that they actually have the resources to engage in all of the meetings and in all of the processes that are part of the humanitarian system, that they have the chance to access training, and that they really are at the heart of things, and that we don't sort of, I guess, replicate maybe some of the experiences of other marginalised groups within this context. I'll stop there because I think it would be great if we can have some questions.
Thanks so much, Emily. All right, so now everyone, would really like to hear from you guys. If you could type into the chat box and I'll moderate the questions. What questions do you have for our panelists? Some of the information that I heard coming out was we need to make sure we don't silo this just sitting in the protection group or the GBV group. Particularly shelter, livelihoods, and health are sectors that really need to be involved in this. I wanted to point out as well that the IASC GBV case management training guidelines has modules on how to work with LGBT populations in there. And we also need to keep people with different sexual orientations and gender identities in the heart of this. It means also asking our own colleagues what is going on. So one of the questions I have here is, panelists, are there any online learning resources that you know about on this issue?
Well, I could jump in quickly on that, and Maria, if you could jump down to slide number 25, I could mention something which is actually just being launched today. It's called Pride in Practice, or PIP. It's a new community of practice for international humanitarian and development workers. I mean, from all sectors, from all thematic areas, who want to get together and discuss emerging policy and good practice in this area. So if you would like to be part of that community of practice, you can. There's more information on the website, which is on that slide at the moment, and that's one resource that I'll throw in for a start. Okay, I have a second question. What do you guys know about any hierarchies that may be reproduced among and across communities in the LGBT population? For example, maybe in some groups, lesbians or gay youth are not heard as well, or things like that.
Sure, I can answer that a bit, and especially how it relates to our work and hopefully more work on this issue in the humanitarian space. Patriarchy is certainly reproduced often in LGBTI spaces. And actually, from what we see from the early research that we have on this topic, most of it is about gay men, gay cis men, a little bit more about transgender women, but there is a lot of invisibility when it comes to other diverse LGBTI groups. So I think that I'm really glad you asked this question, and it's an important reminder that when we're thinking about, engaging more with this topic within our work, that we do it in a way that is equitable and that does not reproduce, gender discrimination within this target group.
If I could just briefly add something onto that one, that I think what has happened just by nature of history is that a lot of LGBTIQ organisations have been funded through HIV and health mechanisms, which has meant that a lot of their networks have tended to be in key populations for HIV work, which is another reason why sometimes other members of the community, say lesbian, bisexual, cisgendered women, are not included. You might need to look beyond those most obvious organisations sometimes to intersectional feminist organisations, artists, collectives, and a whole bunch of other places where you might find people because they're not sort of part of that existing LGBTIQ sort of infrastructure.
Yeah, I have another question. What about providing training on these issues to staff in homophobic or transphobic countries? So how do you actually make this discussion accessible? Does anyone have any experience with that? Anyone?
So I mean, it is a really tough one. One thing I would say is that it can sometimes be dangerous to make assumptions, and we've advised some INGOs who maybe have started to very gently seek to include LGBTIQ within certain assessments or training programs that they have in different countries, and it actually turns out that it's raised by someone in the group. And that the abundance of caution was a good thing, but that people in a whole variety of countries are actually already thinking about these issues. and that I think a lot of LGBTIQ work or support work goes on in different countries, through side doors and back doors, maybe not always the front door. I think we kind of need to recognise that a lot of that work is already happening. I think if you can work with country directors and local and especially with local organisations in those countries to try to work out sort of how far can you go at any one time. I mean, we ideally we want to take a rights-based approach to this work, but at the same time, we don't want to make the situation worse by going too far too fast. I think there are in some countries it might be that working through more inclusive religious and faith-based organisations is a way to go as well, and maybe to try to build some of those local sort of that builds like a local constituency for this work. Maybe one of the most dangerous things is if this is seen to be an imposition from the outside, an imposition from the West, and if you can start to very slowly sort of seed the conversation in safe ways inside a country, and draw upon the existing work that might be happening in a more hidden kind of way, that might be a more effective way than just sort of coming in.
Yeah, and I'd like to add, I was working with UNHCR in Jordan in 2015, and they had started doing sensitization around this. And I've also seen some studies, MSF did a study as well on diversity within its own organization. Oftentimes our caution and our fear of speaking around this comes from our own hesitation and fear about this, and that the context we're working in may be more open to talking about this than you think it is. So I would add doing values clarification with your teams. Even just when I was in Kenya, one of the things that I learned was that just being able to introduce what does LGBT mean, and starting to answer questions and starting to have a discussion with your staff opens up avenues to find out more about the any possible barriers for doing this work, but also entry points as well. All right, I hear another question out here, and we haven't heard much from you, Sarah Chenoweth, but what do you think about sexual and reproductive health services as an entry point for GBV survivors?
Thanks, Sarah. I think that there is a tremendous amount of potential there, but that we also have a long way to go. Certainly, like what we saw in Kenya, and I've seen this in other settings as well. Sometimes GBV services or services specifically for survivors of sexual violence are embedded in maternal and child care. And that's important to have there for straight cisgendered women in order to access that care, but it doesn't work for many other people, particularly refugees with diverse SOGI. One thing to sort of add to this mix, which I thought was quite interesting, because yeah, in some settings, I've seen that local LGBTI organizations can really step up and program for refugees. They sort of expand their existing programming. In Kenya, there were a lot of tensions. So even though there were a number of LGBT organizations for Kenyans, for the host community, and they had really pretty good connections with, particularly for gay men and men who have sex with men, had good connections with health facilities that were sensitized. A lot of the LGBTI refugees didn't feel comfortable there. There were a lot of tensions with the LGBTI Kenyan community that were quite strained. And so I think it was interesting, because my impulse tends to be like, okay, let's look what exists. Let's look at the existing LGBTI organizations and how we can build off of them. But there might be additional layers that we have to consider. That doesn't fully answer your point. I know I'm sort of diverging off of SRH services, but it's just another issue to consider. Thanks.
Any of the other panelists have any thoughts on that? No? Okay. I wanted to point out someone in the chat box. There's been an interesting conversation going on in the chat box. And one person mentioned as well that you can't necessarily assume support at your headquarters level, and that we really need to be doing internal advocacy at the staff level, but all the way up, and talking to our organizations about this as well. Do you guys have any thoughts on that?
I think that's essential. Yeah, I mean, I think it would be a fundamental and horrible error to assume that the global South is somehow, more inherently, homophobic or than other parts of the world. And so, in no sense want to suggest that. And I think, one of the interesting things is that came out of an Ida Hobbit presentation a few years ago was a map that showed the diversity of gender and sexuality all around the world that's been happening, all through different communities and societies over thousands of years, and in many cases it is head offices that have as much catching up to do as anyone else. I think one of the challenges is that I think that there are sort of the work that humanitarian development organisations do is pretty specific, and so sometimes just like a general kind of what is LGBTIQ course will be useful, but we really need to have training courses and resources that go to the heart of the kinds of programs work, the kinds of partnering work, that take into account the immense diversity within diverse SOGS communities around the world, and that producing that is a work in progress, but absolutely an issue for headquarters and regional offices and organisations in the global north as anywhere else.
Claire, do you have any thoughts on that coming from the Lebanese context?
Well, before getting into that, I also just wanted to add a few advocacy arguments that could possibly be leveraged for people who are having those conversations. Sorry, is the mic on?
Yes, we can hear you.
Okay.
Great.
The first one being that protecting sexual and gender minorities or LGBTI people is intrinsic to humanitarian principles. And it's actually a part of the sphere guidelines that don't go much further beyond that. But in general, non-discriminatory humanitarian assistance means that all individuals should be able to access assistance regardless of their sexual orientation or gender identity. Secondly, discrimination against LGBTI groups is illegal under international law. I mean, there are many legal debates within this that one could have, but there is evidence to show protections of sexual orientation and gender identity in international refugee law and in international human rights law. And thirdly, including sexual and gender minorities does create better humanitarian program outcomes because people's specific needs will be better served. And this is an argument that has been made by a lot of gender advocates trying to mainstream gender into humanitarian practice. And I think we can use similar logic and advocacy for LGBTI groups. And then fourth, actually the largest international humanitarian donors advocate for the inclusion of sexual and gender minorities and LGBTI persons. This is looking at the top 5 donors from data from 2016 that provide about 65% of humanitarian aid, and this includes Canada, Norway, Sweden, the UK, and the US, and they all have LGBTI kind of policy commitments. So again, these are nascent and kind of optimistic advocacy arguments, but I just wanted to include those as some helpful framing for people, again, having these conversations.
Thanks so much, Claire. Now, unfortunately, we have a million questions in the chat box, but we only have 2 minutes left on the webinar. So I'm going to close it now and then turn it over to you guys for one last sentence. So while you're thinking on it, I'd like to thank all of you guys for joining us today on the webinar on the International Day Against Homophobia, Transphobia, and Biphobia. Big thanks to the Interagency Working Group, Maria, for doing the technical support on this. And thanks to our other co-hosts, the Interagency Working Group LGBT Sub-Working Group. You can see on the slide here more information about our panelists and how you can get involved. We'd like to continue this conversation on the gender-based violence community of practice. If you want to be a member of our community of practice, you can send us a message to gbvcop@gmail.com, and we can add you onto it. All of our participants have agreed to answer any questions you have on there. And we'll also share the PowerPoint if you get in touch with us. This webinar has been recorded and it'll be hosted on the IAWG website, so you can be able to find it there. So last thoughts or words, Sarah, Emily, and Claire.
Sure. My last message to everyone. First of all, thank you. The turnout was great. The questions are awesome. My last point is disaggregate. You don't lump everybody together. Make sure you have targeted programs, interventions, understandings of all different types of LGBTI persons. Thanks, everyone.
All right, Claire.
I would add that the main purpose of humanitarian protection is to improve the lives and the well-being of some of the most vulnerable individuals in the most dangerous environments globally. And if we're not including LGBTI persons or people of diverse OGS, we aren't doing our job. So let's do more.
All right, and Emily, final word.
Please stay part of the conversation. This really is an emerging area of practice. If we can go beyond tokenism, if we can go beyond extractive approaches, if we can really deeply engage with communities and each other, then I think we within this area, diverse OGS inclusion, we can learn from everything that's happened in protection in the past and try to make sure that we don't leave another group of people behind.
Great. Thank you guys all again. And again, happy Idaho Day. And we look forward to hearing from you again. If you have ideas or thoughts for further topics or to continue this conversation, please be in touch with us and we're happy to host more webinars. All right. Goodbye, everyone.